Hi, I'm Dr. Gago. I am the medical director at Gago Center for Fertility and Gago IVF, and I want to explain to future patients what to expect when they come to our office and how our process typically works. We like to meet the patients at the first visit. We schedule a consultation. You will meet with our nurses and we will get your medical information and it will be put into our electronic medical record. I will then come in and meet you and review your history with you, any previous evaluation or testing that was done with your general OBGYN or in other places. If you haven't had any previous testing, we will go through and make recommendations about testing. Testing frequently includes blood work for the female partner, evaluation of the uterus, fallopian tubes, and ovaries. We recommend a semen analysis for male partners. And we also do other specific testing depending on couples' past history and scenarios. Once the testing is done, we will have another appointment where we will go over the results and talk about treatment recommendations. Couples vary in what the recommendations are depending on your circumstances. I try to offer a range of treatment options for different couples so that your personal, religious, and ethical choices are also brought into the complete picture and we can talk about options. It's typically a process where we start with the least invasive process possible in an effort to achieve a pregnancy, all the way up to the most sophisticated high-tech process, which is in vitro fertilization with pre-implantation genetic testing. So some of the procedures that we perform, one is called a saline infusion sonogram. It's a transvaginal ultrasound. We place a small catheter into the cervix and infuse saline into the uterine cavity to evaluate the shape and structure of the uterus. We also evaluate the fallopian tubes to make sure that they are open and clear, and we look at the ovaries at the same time. A second procedure that we offer to some patients is office hysteroscopy, which is a very tiny flexible camera, 2.8 millimeters, that's inserted through the cervix, and we can actually visualize and look at the mucosal layer of the lining of the uterus to make sure that it is healthy and looks receptive for a pregnancy. At Gago Center for Fertility and Gago IVF, we strive to offer personalized care plans to couples which will suit individual needs for ethical and religious and personal beliefs and desires in pursuit of family building. And we offer treatments ranging from medicated ovulation induction cycles with and without intrauterine insemination, injectable treatment therapies with and without intrauterine insemination, and in vitro fertilization, including high-tech procedures such as pre-implantation genetic testing.